And we begin with a growing threat as COVID restrictions relax. We're talking about the Delta variant. It continues to spread across the country, causing hospitalization surges in some states. The CDC says it is now responsible for a quarter of the cases in the U.S. And another twist, the symptoms from Delta might not be the traditional COVID symptoms that we've come to know.
WCNC Charlotte's Chloe Leshner is live at Novant Health's vaccine clinic in East Charlotte. Chloe, what are some of the people who have the Delta variant experiencing?
Well, it's not the typical loss of smell and taste that we all immediately now associate with COVID. It's more of a runny nose or sore throat, and that could complicate things in flu and cold season. The Delta variant is different.
And this virus more efficiently binds to those cells and then enters those cells and may in some ways elude the immune system more effectively.
That's what makes it more contagious and more likely to do damage in communities with lower vaccination rates. Top officials with the World Health Organization warning we may be moving too quickly and lose control.
Remember last summer where we had everything got good and then everyone kind of relaxed, and then we kind of arrived in September or October and ended up in huge trouble. Well, I think that's where we're going again with a much more transmissible variant this time around.
Some of the symptoms are different too, more like a common cold, presenting a real challenge as we move into the fall.
Clinicians got to think through that. They're going to have the testing they need to distinguish these viruses, make sure it's not COVID. Because it's going to get pretty confusing when there are a lot of things circulating in the community.
And the longer people wait to get vaccinated, the more opportunity the virus has to mutate again.
I think it's these kind of fires we're going to be trying to put out, repeatedly as we go through the summer and into the fall. And, the hope is that people in those communities will get vaccinated. And so the fires will just kind of be smoldering embers instead of wildfires. But that may be what we're dealing with for a number of months.
So we've seen decreased demand for vaccines for months now, but it's gotten to the point where they are scaling back some of these mass clinics. Novant Health's clinic here on East Independence Boulevard now only open on Tuesdays and Thursdays, and it closes early at 3 o'clock on Tuesdays. Medic headquarters, the clinic that was there run by the county health department, is closed now. But of course, there are still plenty of places to go and get vaccinated. Lots of pharmacies and doctors' offices have the shots now. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Thank you, Chloe.